They're working to remove the stigma of veterans seeking mental health care. Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers. Joining me now is the president and co-founder of the Veterans Refuge Network, Andrew Turner. Thank you so much for joining us today.
Yeah, thank you for having me here.
You founded this organization a couple of years ago. Why did you found it? What need did you see out there? And then what exactly do you do today?
Sure. So about 2 years ago, myself, my wife, and then a friend of ours lost 3 veteran friends of ours to suicide within the span of a year, and it really opened our eyes to the problem of veteran suicide. We started doing some more research and finding out that 22 veterans a day are committing suicide, and we decided that something needed to be done to combat that and start to help these veterans more appropriately, because they're obviously not getting the help that they need.
And so what then does your organization do today to try to reach veterans and get them help?
Sure. So the first thing we try to do is raise awareness of the problem and let people know that the issue is as bad as it is. We also want to eliminate the stigma associated with seeking mental help or mental health help among the veteran community so that they feel comfortable asking for help, and then connect them with resources that can appropriately give them help when they're ready.
And you sort of do a couple of campaigns each year to get the word out, to connect veterans who you say is it the veterans themselves or their families themselves that maybe are uncomfortable talking about suicide and getting help, or is it sort of society around them?
Sure, I think it's a combination of all that. So it's not a comfortable conversation topic for people. I think they want to know about the issue, but at the same time, they don't want to know about it. So we've had a couple campaigns to raise awareness where we've put 660 crosses out for an entire month to represent the number of veteran suicides that happen in a month, to try to raise awareness and let the community know that we're here, we recognize the problem, and that we're here to help if there are veterans that need help.
And you are based in Washtenaw County. I know it's easy for folks in that county to get services and to get in touch with you, but you serve others as well?
Yeah, so if they can reach us on the internet, they can get a hold of us. We've talked to people as far as Idaho and California, but most of the people that we work with and the resources that we have are in Southeast Michigan, and we have a lot of good connections that we can connect veterans to and get them help.
So obviously you felt, you must have 2 years ago, that there weren't enough programs or really information out there for veterans. There was a need for somebody like you. Is there still a lack of information, of resources out there for veterans who are struggling with mental health?
I think there's a growing number of resources, but there's a lack of awareness of the resources. So a lot of veterans don't know what is available to them. So one of the things we're able to do is connect with different resources in the area, and then when a veteran comes to us seeking help, we can point them in the right direction that maybe they weren't aware of.
All right, so you've been doing this for 2 years now. Success stories, do you feel like you've been able to really lead some folks in the right direction and make a real difference?
Yeah, we have. So, I mean, we get contacted by people that we are able to say, talk to our friends over at Give an Hour and they can give you free counseling, or talk to our friends in Brighton at Sticky's Dogs and they can help you with a service animal. So we definitely have, maybe not a solid number of the people that we help, because sometimes it's a little harder to judge, but there's definitely solid examples of people that we know we're connecting with, we know that we're helping, and we know that we're making an impact on.
And I would imagine folks who are struggling with depression or are suicidal or maybe headed in that direction, they're not even thinking clearly as to how to get help or where to go, which is where you can help out.
Right, exactly. So when the veteran is in that dark place and considering whether or not their life is even worth continuing, the healthy plan for getting their life back in order is not at the forefront of their mind. Their mind is just consumed with, how do I hang on one more day? And unfortunately, 22 people every day reach that point where they feel like they can't hang on anymore.
Awful statistic. Thank you so much for joining us. Thank you for doing what you do.
Thank you.
For more information on today's topic, you can visit Facebook. Head to facebook.com/Veterans Refuge Network. Today's Comcast Newsmaker was Andrew Turner, the president and co-founder of the Veterans Refuge Network.